This was started by Dr. Ira Katz, who was the chief of mental health for the entire nation. When he started, the window was only 3 months, and we were not able to recruit as many patients as we were wanting, so the window is broadened to 6 months. So they got to have either major depression or bipolar disorder, and have to have had a suicidal behavior, a violent act, or a hospitalization to prevent a suicide attempt within the last 6 months. This is a 1-year participation, so anybody who gets into the study will be in the study for 1 year. They'll get lithium or placebo for a year. They take twice a day, and the program goal is to enroll 1,862 veterans with eligible for the study who have tried to commit suicide. And the very reason that we are doing this study is a indication of the dire situation that we are in. Our goal is to recruit about 4 subjects per month, and we are way behind the curve. And currently, over 250 veterans have been enrolled nationwide from this study. So I already went through the inclusion criteria, but the exclusion criteria is anybody who has schizophrenia is not eligible for this study. Anybody with psychosis is not eligible because of the medication that we are using. People who need to be in a medical facility for alcohol or substance abuse withdrawal or detox are not eligible, but we can reevaluate them after they're sober up and they're ready for other treatments. There is no cost for the veteran to participate in the study. So the VA takes care of the medication and the visits and others. And we do compensate for travel. If they are coming within 50 miles, we give $50 each time they come in Kroger gift cards. If they are coming more than 50 miles, so we give $70 each visit. To give you a perspective of how many visits, the first few weeks, first 6 weeks or so, we see them almost every 10 days to get the lithium level at the right place. And after that, we see them once a month. Wow. So quite a bit of reimbursement there.
Quite a bit of groceries there.
Yeah.
And gas.
So how can you help? Get the word out. And we also need the psychiatrist who is treating the patient to give us a concurrence that it's okay for their patient to be enrolled in the study. So if you are one of the psychiatrists that gets the email, please read the email and respond to it one way or the other. It could be concur, or it could be that this patient is not a good candidate for lithium, and you respect that. And recruitment, so spread the word out, and we really appreciate that. So those are the numbers. Cindy had to leave. That's her number and my number there. So just take a warrior class for her.
Thank you so much. Great information. Dr. Liggett, thank you for that. So I will give both Larry and Johnny an opportunity to introduce themselves. And while they're doing that, if you had any questions that you wanted to ask the panelists, if you would write those down, and Richard will collect those and read those. And then what we're hoping from you all as panelists is to just have an open discussion at this point. They'll provide a question, and then you all, as you feel you have something to provide, we hope that you will do so. And we just want a discussion. We really want it to be an open, honest discussion so that we can learn more from you. We really appreciate everything that you've already shared with us, but maybe somebody will bring something up that we haven't had. So, Larry, if you want to introduce yourself and maybe just give a little bit about your background, and then Johnny, if you will do the same, and then Richard, if you have some questions, that'd be great.
I'm Larry Butler, I'm a person support specialist. I'm also a person with mental illness. I've been diagnosed with depression and anxiety. I'm also on the alcohol addict. I was homeless 20 years before coming to the VA to receive services. Of course, I did not read. It took me 3 times. The first 2 times I didn't listen to what Harry and Dr. Bernard said. You know what I'm saying? I just wasn't ready to hear all of that yet. I had some other, I had to go back down and just try a bit more. just gonna skip through it because one story is almost like the same. I'm just gonna get to the meat of what happened, what changed my life. The third time I came back to the VA, I was willing to listen to the fact that I might have a mental illness. Mental illness was not anything that we discussed in our homes very comfortably. When you talked about mental illness, it was not a cool subject to talk about because the culture that I grew up in, no one quite understood what it meant. It meant that I was different, that something was wrong with me, and that I would be identified as a person and that no one wanted to come around. I lived with that belief for a very long time, so I would come to the hospital and get help for my substance abuse, but I would not treat my mental illness. Except for that third time, I heard it just enough where I was willing to listen to what they were telling me about me. And I found it to be true. When I started listening to some of the symptoms they talked about with my disease, it matched up with some of the things that I was actually doing. So I decided I would go the next step, and the next step was a real major decision for me because it was medication. I was not comfortable with taking medication because the only medication we ever heard of was Thorazine. I'm not taking that mess. You know, I didn't have any idea how advanced medications had become for people with diagnosis with mental illness. So I started on the medication, and I did that for 2 or 3 years, and then I talked to my doctor, and I was able to discuss psychotherapy. I wasn't ready for group therapy yet because I didn't want to talk to a group of people about my disease, but I was able to talk to one person. So me and this doctor kind of built a relationship, and after about another couple of years, she suggested maybe I'll try group therapy. And I'm still in group therapy today, and it worked for me. I came into treatment May the 10th, 2004. I haven't found it necessary to have another drink or come to the hospital for any illnesses such as that again. So what I would like to get after is that the VA have many services, but getting information out there and making those services accessible is what's important. That's what I do as a group. It's important. That's what all of us do that are employed by the VA. We go out and whether we know it or not, we do what we need to do. If I see a veteran anywhere that needs help, I don't judge the veteran because I would have never thought today that I would be sitting here doing what I'm doing after being in and out of incarceration, beat up, shot up, left for dead. I know it's kind of graphic, but it's really real. See, people with mental illnesses is not as dangerous as people that don't have them or not supposed to have them. We get hurt by a lot of more people more than we hurt other people. And they're just a known fact, you know. So I just want to say that recovery is possible. And thank everybody here today for being here, because your interest must be to help another veteran. And we thank you for that. And as veterans, I'm grateful that I accepted the help that you offer. Thank you.
I'm Johnny Cartwright. Just like you, a combat veteran. When I come home, it was 10 years, right at 10 years before I even wanted to even know what PTSD was and raise my hand and see how maybe y'all probably are right. You know, people's calling me like, man, you can get PTSD, what the hell? And I was, no, I'm Johnny Cartwright. I got this, and you're a sissy for going to be that's just my approach to it because I had already kind of found what I thought was my groove, and that was I'm a workaholic. I worked 16, 17, 18 hours a day, 7 days a week. It wasn't long before workaholic become alcoholic. So in 2015, when I come up here, I was crawling. I wasn't walking. I hid. I don't think things could have got any worse than what they did. And fortunate enough to meet Mr. Harry and Royce, and like you, I didn't listen to anything they said for 28 days. I went on to the PTSD program and got the opportunity to work with Dr. Reader and staff in the hall, and they were very helpful. And really, what that was to me, that was a learning stage, coming to understanding what PTSD was, and how it was actually affecting my life. And once I started understanding, what it was, and man, the doors started popping open. Well, that's why this is happening, or that's why this is happening. That's why I'm dealing with this, and things things didn't get better when I left there, things got worse. Because then I started seeing them and how they were affecting my life. And so it was like I left and I was on this high, and I hit a low as soon as I left. And I won't take medication, but I'll take vitamins, and I'll run around. I go to the pharmacy over there and I'll get a big old sack of vitamins every month. That's my med. I used to take the other time. If I'm gonna do that, I might as well drink. I'm gonna have to cover it up, mask it up. So I'll just do it sober. So I hit that low, and I did what Johnny Cartwright does. I started drinking again to deal with the hurt and the pain, and to keep from feeling, be numb. I called Harry up and said, Mr. Harry, said, Johnny Cartwright, I don't know if you remember or not, but I need to come back. Just like Harry said earlier, he said, we open. I think he said we open at 7 in the morning. I'll be here at 7 in the morning, or be up here in the morning. But he made it clear that come up here, we'll get you help. And I did. And this time going through, my eyes were open a little more. It seems like I worked my ass off, truthfully, just to be blunt about it for the last 2 years. I've worked hard to get through this, and so it seems like the little further I go, the more my eyes open, and my heart opens to things, and I'm able to see and understand things that are going on. And I got a lot out of Mr. Harry and Royce in the program this time. And their staff is very helpful, very compassionate, full of empathy. I mean, it's amazing to see the people that go through there, the things that they put up with, and they still have that amount of compassion. That's a tough job, and they do an excellent job at it. And they truly help me. I still go by and see Harry. We have conversations 2 or 3 times a week. If I feel like something's getting to me, I go see Mr. Harry. I go see Royce for a laugh. Still do that. And Dr. Reeder, I worked with Dr. Reeder and Dr. Cooney, and Dr. Reduca doing PE. PE is the toughest therapy I probably ever went through in my whole life. Done two rounds of it. And just to give you an example, a year and a half ago, I would not have been sitting right here talking to you. I would have been up here crying, or looking at the floor, I would have looked you in the eye. My anxiety would have been crazy, and that's if I would have made it out of my door to get here. That's how far I've come. I wish I could have the time to show you how far I've come. To me, it's just amazing. But I worked, I accepted a lot of things. I found some forgiveness. I read, I started reading. If it was about PTSD, if it was about Vietnam veterans, the stuff that they come home and deal with and how they got through it, I read it. I probably read a book every week and a half. Just the knowledge of it, and I found ways where I'm not the only one. That's a circumstance that was almost just like mine. It's just giving some compassion towards me, and a lot of veterans don't have that. We judge ourselves and beat ourselves up more than we'll ever allow anybody else to do. And I found those things, and I found it because of the people like Carrie, because of people like Dr. Reeder, because of people like Royce that work here at the VA in those programs, and they wouldn't have let me feel it. And because of that, I'm sitting here today in front of y'all, and I'm able to have a conversation, look at you in the eye, I'm probably sweating pictures. That's that's part of it. I can accept that, and we'll move on. But thank you, and thank you for letting me share. Thank you.
Hey, Richard, you got some questions?
The first question is for Dr. Padala. Is there something that would trigger an individual at age 65 or older to commit suicide? That's a two-part question. Have you learned any signs that we need to look for in individuals age 65 or older to commit suicide for that age group?
There are several risk factors why elderly kill themselves more often. As you can see, the transition in life is a huge risk factor from provider to somebody who is dependent, and the hormonal changes are reported to be a contributor, more depression in this age group, memory problems that add on to it, so all of these compound to be risk factors. Was there a question specifically about lithium?
No, it was just regarding age 65 and older. Any specifics to look out for, or specific triggers or something?
There is a rating scale I can share with the group here. Maybe I can send it to you and you can put it on there. Looking specifically for elderly persons. But things that we talked about, depression is the biggest risk factor for impending memory problems, but I can send that out.
That would be wonderful. Thank you. We'll add that to the information.
If anybody else has an answer or comment to a question that may not be directed towards you, please feel free.
Can I just follow? Is that reflected in others? I mean, you're looking at from U.S. population numbers, Canadian, other. Does that reflect the same pitch points?
The disparity in the age is not as much in other cultures as in US, perhaps because of our more reliance on individual productivity than other cultures. Like, I'm from India, and we do not see that disproportionate increase. There is an increase with age, but not as much, maybe because there is more combined joint families, more reliance on other family members. But there is an increase with age, not as much in other cultures.
The next question is for the panelists that make an answer to this. Where are all the inpatient facilities located in Arkansas? We know we got here at Central Arkansas. Poplar Bluff does not have any. Specifically, Fayetteville, Memphis, and Shreveport. Do those have inpatient facilities for PTSD,
Memphis does.
Memphis does.
I don't know about any of the others.
Fayetteville has inpatient site, but I don't know about
I
the,
think it's a specific PTSD program. Biloxi is another one in our vision, and they routinely take patients referred through our VA for different reasons. For example, an example of that would be if we had a VA employee here who was a veteran that needed PTSD treatment, and it might make more sense to get them down to Biloxi, get them away, and give them a little more ammunition, something like that.
Shreveport, anything of Shreveport?
Yeah.
I think the point I was making is that, and from outside the sphere, outside the bubble, the facilities here and the programs here are renowned, and I'm not sure we recognize that. Living here within the bubble, we're just going to four roots. This program has significance nationally. When we talked about Veterans Treatment Courts and other efforts that we've made, it comes back to the programs that are on behalf of the staff here, is that we need to recognize that this makes us a significant center point for thought, research, leadership of programs that's really markedly national. Yes, there are research programs that go on in many other facilities, but very simply, not a practitioner, just someone who has been working in the veterans community nationally in the conversation, is that this place makes a difference. And that's something that you all can be proud of, being participants and part of that system. But we need to recognize that. I'm not at all surprised. I am really surprised that Poplar Bluff does not have that capability, an inpatient capability. Certainly Memphis would, Fayetteville, and that's very doubtful if they use our Shreveport. And to Tanya's point, we start out and we talk about this is the Central Arkansas Veterans Mental Health Council. I view most everything geographically on a statewide perspective rather than on the VHA region. So I always kind of put an asterisk by things, because to the extent that we can reach out to Lawrence County and to Benton County and Miller County and Drew County in all four corners of the state. Those are things that we can't, we have to recognize that with this we have something that we should be able to find ways to make it work. And so when in the middle of the night you're taking off to go to Walnut Ridge, and at that point in time, yeah, you may know that Poplar Bluff is in Lawrence County, is in Poplar Bluff's catchment territory. You're in Jonesboro and you're in Memphis, and we ought not to get soldiers out far without knowing where their line of support is. And
If we could, I'm sorry, we need to get to the next question, I'm sorry.
So Dr. Reeder mentioned how civilian life doesn't always work well for military mindset or culture. What suggestions does the panel have for helping improve this mismatch between civilian and military culture or worldview? And I'd like to hear from everybody on this one. If we can start here.
Sure. I think certainly we're talking about two different cultures, and I would, as a veteran, my challenge to other veterans is this idea that we've been civilians before, so it's certainly not foreign, but we have to break down some of our assumptions as veterans, that civilians can understand us, that civilians won't accommodate us. I see examples of that all the time. Civilians doing great work with veteran communities, and it has very little to do with the past experiences these people have. There's just shared goals. I like to put all this in the context of the veteran knows two languages. They know the civilian language to a degree because they've been in it. It doesn't make as much sense. But they also know a military language, so to speak, and the ability to speak both languages is a tremendous skill if you can manage it. In terms of what to do, I think it's very important to normalize some of these feelings. Again, readjustment doesn't have, you're not going to see many readjustment programs out there or treatments for readjustment, so to speak. So the one thing I think we're really challenged with in this area is we don't normalize it. In other words, almost every veteran I talk to about readjustment feels very alone in it. And they don't feel like there's much in a structured way they can do about it. So personally, I'd like to see more programming in that area, and I do think the programming we do here over across the road is pretty unique because there's just not that many people that actually target readjustment and look at it as a new phase of life that people have to negotiate very carefully.
Yeah, I think readjustment plays into our support groups as well, because we've heard a lot of that. Jonesboro's got a lot of factories in there, so a lot of our veterans are factory workers on various levels. Some may be line managers and some are just workers. And they find it difficult to, for the managers to speak to a civilian in a way, because if they were an NCO in Army, Marines, whatever they were in, there's a way that you talk to your soldiers and you knife hand and you do this and you tell them exactly what to do. And then the soldier is supposed to do exactly what you say. And that doesn't translate well to the civilian. And then the worker is expected to be told exactly what to do and not go figure it out. And then, when we're able to get together and talk about these things, in our groups we don't say, you should do this and you should do that. We are more, this is what works for me when this happens, and I've done this when that happens. So I think the more that we can get together, so to speak, at a round table and talk about how we handle going back to work and how we handle, whatever it is, we can spread the ideas together of what's worked for us and then maybe build something out of that.
Before that, in the military, right, you get this culture pounded into you, and it becomes who you are. It's who you identify with. And I guess for like a civilian to grasp that would be like, grow up until you're 10 here, and then move to a foreign country for 30 years, and when you come back, this just isn't your culture anymore. It is, but it's not. And so I think that, active duty or separation really is where it should start. There should be something that kind of starts unwinding you from that mindset. And then the other thing is, Dr. Ritter, when he was talking his thing about, you know, the worldviews and beliefs and feeling broken, I've never met him before, and it felt like he was talking about me specifically, because those beliefs are exactly what I've struggled with. And looking in the mirror when I'm shaving in the morning and saying, I'm a broken person, I'm a broken person, I'm broken. I have PTSD, that means I'm broken. And we started using our group. It actually started in Northern California from a PTSD group. Post-combat normal is a phrase that we've been using, and it takes that stigma of being broken away, and it's helped build confidence in our group when we stop reinforcing the brokenness. So I think that would be, you know, something you can do.
Just briefly, I want to add to that. I can just, when I was listening to you all speak, I could feel the anxiety in my stomach. When I got out of the military, I was absolutely afraid. I just didn't know what was next. I had no idea how to take what I had been trained to do and turn it into a civilian way to make a living for me. Or if I choose to have a family. I was used to everything being in order. When I came out of the military, there was no order, and that just upset me. I was still very rigid. My belief system had not changed because I didn't have any idea that I needed to change it. And because of my rigid behavior, it kept me isolated and alone. So I continued to do what I learned in the military. I kept drinking, and I was cool with that. So it started to become a problem. Because my drinking led to other things, and other things to other things. And I didn't have any idea that I need to make a real adjustment. And I just really don't think that the military is going to understand how to start helping the veteran make a readjustment to come back to civilian life. They hand the veterans to the VA hospital. I'm just being honest, that's the way it really is, you know. When the VA hospital, when we're handed to the VA hospital, we have to decide, do we trust the VA hospital? A lot of times we don't trust the VA hospital because of what we got going on in our records, of what we got going on in our lives. I mean, you can't even discuss military. When I was in the military, you couldn't tell anyone if you was thinking about harming yourself or if you was feeling depressed. You couldn't be able to keep that to yourself. And so until we become more comfortable, until veterans and people in combat become more comfortable, until we change the stigma that's associated to mental illness, I'm just afraid we may still be dealing with this until we're doing a lot better. Don't get me wrong, but I just think I talk to too many veterans every day who's still not really comfortable. They'll talk to a principal about it, but they won't talk to their doctors, and they won't talk to their therapists, but at least they're talking to someone. I just thought I wanted to share that.
Royce?
Yeah, I like that saying, it takes courage and strength of a warrior to ask for help. We need to get that out there.
That's right.
I see warriors every day.
Yep.
I see warriors every day. But they've lost something along the line. They have that feeling of hopelessness and despair, and they don't think that they can get back into society successfully without drinking and drugs. But if we can get this side out, and it takes the strength, it takes the courage and strength of a warrior to ask for help.
That's right. Mr. Williams?
I have suffered short-term memory loss here, but
Oh, sorry.
yeah, will you read that again?
Yeah, I thought I was going to have to read it again when we got to Royce, but he already had the answer already.
Program like that.
But now, so what suggestions would you have for helping improve the mismatch between civilian and military culture in trying to reintegrate military personnel back into society?
I'm ex-military. It's a mindset.
Yeah.
I think people are very flexible. What works on my unit, SUD, is that we don't try to fix people. We just care. Okay, and they work it out in time. I think we do too much fixing. And you know, I have a different belief system. I think we're all broken. But you have to be broken before you can be whole again. And so this is a great place to start. That's our message. And it's always been our message. And it works. We're doing a damn good job. I used to be a recruiter.
You give a good pep talk, Gary.
Thank you, man.
I'll tell you on a personal note, I went through a program